Okay, hi, my name is Dr. Eric Herman, and I want to show you some techniques that I do in my office that are quite unique. Billie Jo here is having some pain in her lower back that's pretty severe, and also going down the back of her legs, which is also known as sciatica. So what I do is a combination of acupressure, which is Chinese medicine, and chiropractic. So we're going to test some muscles in her lower pelvis that relate to sciatica and are usually very weak when a person is suffering from sciatica. So what I'm going to have the patient do is, could you take your hands off your body, bend this knee up, hold here, and don't let me pull out. Push in. Okay? Notice how that's very weak. That's called the piriformis muscle. And I'm going to go on the other side and check the other side. Bend up and hold, don't let me pull out. Okay, again, that's very weak. So in acupressure, there's a point that so-called gives more energy or removes energy blockages from those muscles, and it happens to be right over the bladder on the pubic bone. So I'm going to have Miss Billie Jo find that point for me, right on the bone. You feel the bone there? Keep your fingers there and touch it. The theory is, in Chinese medicine, that she's putting more energy from her hand into the energy circuit, which is called the meridian. Now let's see what happens to the strength of her muscles. Bend. Hold it. Don't let me pull out. Okay. Does that seem stronger to you? I'm going to check the other side. Bend. And don't let me pull out. Push in. Very strong compared to without touching, right?
Yes.
Let's check again. Untouch and bend up. Now don't let me pull out. Yeah, very weak, right? And it's more painful when I pull? Okay.
Yes.
So what we're going to do, being that that's a spot that's kind of iffy, normally I would rub with my hands to do acupressure. We're going to use a massager with Billie Jo's permission and just stimulate that acupressure point with this. You okay with that? Okay, so there we go. Hope you emptied your bladder today.
Yes, I did.
When I press down on there, is there pain?
Yes.
Usually there's pain at the point of involvement on the acupressure point. So that tells me that I'm on the right spot. And usually with acupressure you want to go about 15 to 30 seconds of pressure and stimulation in that area. Pain? I'm sorry, but it's for the better good of you. Okay, now what we're going to do is go back and recheck those muscles without her touching the point to see what has happened. Bend the knee. Now hold, don't let me pull out. I'm pulling really hard. Does that feel different?
Yeah, stronger.
Okay, do you feel less pain when I pull out?
Yes.
Try this side. And hold, don't let me pull out. That is excellent. One more check I'm going to do just to confirm. Now I want you to keep your leg straight and raise it up 2 inches. Hold it up, don't let me push it down. That's very strong, that's what I want. Hold it up, don't let me push it down. Good. Now, if you could, I want you to just get up and bend a little bit and tell if the actual back pain feels different.
Yes. It feels much better.
It feels much better.
Yes.
So I just want to point out, I did not even touch her back. That's the power of Chinese medicine and acupressure. Now probably after I shut the video off, I'm going to go and check some more things. But a lot of times when a patient has sciatica, that technique and that technique alone is what clears it out very quickly and very effectively. Thank you very much. That's my video on acupressure and sciatica. Hit it again and it should shut off.